Diagnostic Laboratory, Inc.
Welcome back to the broadcast. With it being summer, we thought it would be a good time to talk about being in the sun and how that can affect your health, not just your skin. So Dr. Tara Dahl from Health Diagnostic Laboratory is here with us now. So I guess we're going to talk about vitamin D.
Yes, so there are many people that have vitamin D deficiency. And actually, the darker our skin, the more likely we will be deficient. We're less able to make vitamin D from sunshine.
And I'll tell you that this is true because my panel that you all did for me, even though I was okay in most everything, I was low in vitamin D, extremely low, like dangerously low, to where I have to take a supplement now.
There's a surprising number of people that are low in vitamin D. And you think that if you're getting sun exposure, that's enough. I mean, 15 minutes of sun exposure a day should help us produce the amount of vitamin D that we need. But for whatever reason, some of us just don't make it. When we're low in vitamin D, we're at risk for heart disease, we're at risk for cancer, blood pressure, autoimmune problems, and it's kind of a simple thing to measure, and it's something that really gives us a lot of information about other potential risks that we have. So, and it's easy to fix. You know,
and it can be the reason for fatigue as well, right?
I think it's one of the most common causes of fatigue, and not just fatigue, but muscle aches.
Oh,
you know,
wow.
There's a lot of people that feel achy all the time. A lot of people who are on cholesterol medications definitely feel achy, and I find that sometimes it's not actually the medication, it's actually the fact they're vitamin D deficient and they haven't been treated for that.
Wow.
So there's a lot of things that we can gain from that. So, you know, there's always the risk and the benefit of protecting ourselves from the sun. In the summer, you know, we wear sunscreen and we bathe in it.
And that's what I was going to ask you. So if we're applying sunscreen, are we still getting the benefit of being out in the sun for vitamin D?
No, not at all.
Okay.
You completely block the ability to get, you know, vitamin D from sun. The thing about sunscreen is, too, you got to make sure you're using sunscreens that don't have toxic chemicals in them that then are getting absorbed into our body. We forget that when we rub stuff on our body, it's like medicine. It goes in, and so we need to be really careful. And sunscreen tends to be something that, while we certainly want to protect us from some skin cancer, we also need to be careful about what we're putting in our bodies.
So I'm curious. Hello, Fancy. This is our little mascot. I'm curious, Tara, you know, when we talk about something as simple as vitamin D, and you go to your doctor and you're feeling fatigued, oftentimes, most of the time, your doctor isn't going to say, hey, let's check your vitamin D. It's not one of the typical tests that a doctor would do.
Right.
So what needs to happen to kind of change that tide so that doctors are realizing that sometimes it's something simple like this that doesn't need to be treated with major big pharmaceutical drugs?
Right. Yeah, and actually, I mean, I think it's a matter of asking for it. I think most people, if they said I'm concerned I might have a low vitamin D, I mean, most doctors would be willing to order that. It's usually something that we have routinely on our panel that we do at HDL. You know, vitamin D is something that you can pretty safely take 2,000 international units of vitamin D3. Make sure you get D3. That's the type of D that you want. It's got to be in a gel cap, so don't get the ones that have calcium and magnesium and vitamin D in them.
You want just
You really
D3
want the one that looks like
cap.
almost like a fish oil, little mini gel cap. That's what's going to be best absorbed. And, you know, taking 2,000, nobody's going to get toxic on that. So even if you don't have a vitamin D level down, you can really take that pretty safely. I'll have to say, from all the patients that I've seen over the years, and I'm checking vitamin D levels more routinely, that most patients end up on 4,000 to 5,000 units of vitamin D3. It's very difficult to become vitamin D toxic, although it's not impossible. If somebody's taking, you know, 20 to 50,000 units a day, and they're doing that for a number of months, I mean, you definitely could get to a toxic range. It's very unusual for that to happen, but again, if people are taking their own supplements over the counter at very high doses, it's possible. And you might become nauseated, you might have fatigue, and, you know, other complications from vitamin D. It can basically cause the calcium in the blood to be too high. But again, it's very rare for that to happen, and most things you buy over the counter aren't going to get you in that range.
So is this why it's important, though, to get the test so you have a baseline,
so you know where your level
so you know
is,
where you're at.
So you know how much you can push it. There is a vitamin D available as a prescription, but I honestly never use it. I find that the over-the-counter vitamin D3 that you can get very inexpensively works very well. And when people are very deficient, I sometimes give them 10,000 a day for, you know, a month or two, and then go down to 5,000. But really, we can do a lot.
Wear your sunscreen to protect your skin, but look into taking a vitamin D supplement. And of course, get your testing done so you know what your baseline is. And if you're feeling tired and fatigued, I'm going to tell you personally, I had the test done. Definitely deficient in vitamin D, so I feel much better taking the supplement.
Good.
So thanks for that.
That's a simple fix. Okay, good.
Okay, you can get more information about the Health Diagnostic Laboratory by going to their website, hdlabinc.com. You can also call them at the number right there on your screen, and we are back with more right after this.